If you feel tired all the time, get bruises without having hit yourself, or see frequent infections in your body, it could be something quite serious, something like leukemia. Leukemia is cancer in the blood and lives in the person for years without the person realizing it. It can appear quickly and suddenly, or it can live for decades, causing health problems to the person without them recognizing it. What are the important signs that indicate your body may be hiding leukemia, a cancer in the blood, and how do you stop it, reverse it, and ensure it doesn't make you sick? Leukemia is a type of cancer that affects the blood. It affects the bone marrow, where blood cells are produced. There, in the bones, is where your blood is produced daily. It can progress quickly or develop very slowly, over years, over decades, but the important thing is to know how to detect it with symptoms that I will reveal in this video in time to save your life. Before continuing, please subscribe to the channel. I am very surprised to see the number of people who watch these videos but are still not subscribed. Press that red button, subscribe, press the bell where you can receive videos that could probably save your life in ways we often don't imagine. Number 1, what is leukemia and what are its main symptoms? Leukemia is the excessive production of certain cells within your blood, which has a very large variety of cells that keep you alive. In this case, leukemia specifically is the excessive reproduction of cells or white blood cells, which are the defense cells, cells that should protect you from bacteria, viruses, parasites, that should ensure you are healthy, go out of control, their production increases, and that causes symptoms that I will reveal to you shortly. Now, the curious thing about leukemia is that this growth or multiplication of white cells in your blood can cause an accumulation of abnormal cells that displace healthy cells. There are many types of leukemia. There's acute leukemia, which appears quickly, or chronic leukemia, which develops gradually over the years and slowly makes the person ill until suddenly they are told that this person has blood cancer. Some of the important symptoms to realize that a person may have leukemia are constant tiredness or fatigue in the face, in the skin, frequent bleeding in the gums, because the nose, the appearance of bruises without having been hit, petechiasis, which are small red spots or dots on the skin. This, by the way, is very important, and it is very common to diagnose with petechiasis or with red spots on the skin in a hospital when a patient arrives. And beside all this, these patients could also suffer from frequent infections, high fever, without a clear explanation, without an infection, without a bacteria that has made the patient sick, night sweats, which rarely happen in other diseases like tuberculosis, and much more. Some people feel bone pain. If it happens to you frequently, it could be that or some other illness, swollen glands in the neck, unexplained weight loss. In short, the body goes out of control. See, the blood is sick. There is an excessive production of white blood cells, cells that should defend you. And with that excessive production, a total imbalance is created in the body. If you want something that can help you keep your blood healthy, well circulated, well produced, and a healthy bone marrow, look for OnCardio, Clear Matrix Red A+, and multivitamin from Finland at finlandvitamins.com. Number 2, something you do daily could be accelerating your onset of leukemia. Among the risk factors, that is, the things we do every day that increase our likelihood of developing leukemia, is often nutrition. Let's remember, our blood se formed from proper nutrition. When we lack nutrition, when we have an iron deficiency, there's a lack of ingredients to form blood, our bone marrow doesn't have the ingredients, it has no way to form them. And wanneer je suppose, du was lack of vitamins, the other plus iron, the complex, the lack of 12 complex, and so on and so forth, the body often cannot form a healthy cell. Anemia comes microcytic red blood cells, that is very small, macrocytic very large, white cells in quantity, platelets decreased or hypoeosinoso also cause. If you are eating poorly at home, if you are not eating healthy, if you are eating junk all the time, not taking or having probiotics, digestive enzymes to absorb nutrients, you are at risk of forming defective blood. Start nourishing yourself. You start absorbing properly. Kau na di kai supplements ko pa de kalu como piana holong ko. Now, lack of nutrition yanemos there's only factors that can accelerate the onset of leukemia. There's what we consume, the drugs that can damage our bone marrow, your toxic drugs, agrochemicals, foods that come contaminated. We all will have tastes sa kahon tao kaon tahar may blood production. There is benzene poiete, for example, which is an industrial solvent used in plastics, very commonly found in products we use every day. There is chemotherapy, which is a drug used in treatments against other types of cancer that ends up damaging our bone marrow. And there is everything that can intoxicate our body. If the body absorbs it, it will fill it with toxins, and therefore, it is a very good idea. 2. Eat well, and 3. Make sure you can detoxify constantly. If you need natural supplements that can help you detoxify, improve your circulation and blood formation, look for OnCardio Red A+, the enzymes Probilion, and in addition to that, multivitamin from Finland at finlandvitamins.com. Number 3. How is it diagnosed and how is it cured? Leukemia is a cancer of the blood. The cancer is precisely circulating in our body. The first thing to do in this case then is to take a complete blood test, and with this be able to show very high or very low white blood cells depending on the type of leukemia you may have. In addition to that, a bone marrow biopsy is usually done. The marrow is punctured, that is a part of your bones. The tissue is removed, which is the marrow, and it is examined to see exactly what this marrow is forming to understand what type of leukemia you are suffering from. And finally, genetic studies are conducted. Some studies can help classify the type of leukemia and guide the treatment, but in any case, you must ensure that your body has all the necessary ingredients to form healthy blood. Visit your doctor, make sure you can know exactly why you have leukemia, how old you are, what type of leukemia. Leukemia is a type of cancer that affects the blood, affects the bone marrow, and if you need a consultation to guide you, the secretary's number is below here on YouTube, so you can contact us. A like to the video. A big hug.